Dr. Ioannidis, when we spoke to you on March 23rd, you said we needed more data before we could ascertain what was happening. Since then, you've been busily gathering that data and have published 3 studies. Let's start with the latest one, which you entitled COVID-19 Antibody Seroprevalence in Santa Clara County, California. What was the purpose of that study, and what did you discover?
This study aimed to generate an estimate of how many people in Santa Clara County have been infected with the virus. And the way to find out is to try to see whether they have developed antibodies to SARS-CoV-2. So we had a sample of residents in Santa Clara County evaluated for the presence of antibodies. And the sample was 3,300 people who came to be tested. We estimated that based on what we saw, between 2.5 and 4.2% of the population of the county has antibodies, which is an indication that they have been infected with the virus a while ago.
What are your conclusions based on your study?
If you compare the numbers that we estimate to have been infected, which vary from 48,000 to 81,000, versus the number of documented cases that would correspond to the same time horizon around April 1st, when we had 956 cases documented in Santa Clara County, we realized that the number of infected people is somewhere between 50 and 85 times more compared to what we thought, compared to what had been documented. Immediately, that means that the infection fatality rate, the chance of dying, the probability of dying if you are infected, diminishes by 50 to 85-fold, because the denominator in the calculation becomes 50 to 85-fold bigger. Our data suggests that COVID-19 has an infection fatality rate that is in the same ballpark as seasonal influenza. It suggests that even though this is a very serious problem, we should not fear. It suggests that we have solid ground to have optimism about the possibility of eventually reopening our society and gaining back our lives.
Sooner rather than later, I hope.
Sooner rather than later, with full control and a data-driven approach.